Back to school is a stressful time for many children, and this year will be more challenging for some as they return amid the pandemic. So joining us live with more on this and some tips to help families is Dr. Dina, Kulik, a pediatrician, pediatric emergency doctor, and the founder of Kid Crew. Doctor, thank you for your time this afternoon. I'll start by asking you what parents should be looking for when it comes to recognizing if their child who is a student is struggling with some anxiety going back to school.
I think it's both what kids are saying and what they're doing. So if your child is, retreating to their bedroom or not willing to talk about things, or they're not eating well, or they're not sleeping well, or you find them doing things that are, we see in terms of anxiety. So things like nail biting or scratching or picking or other, physical means where you think they might be feeling anxious, feeling sad, feeling scared. That's when you want to open dialogue with your child and try to see what they're feeling, what their fears might be. What are they seeing? What do they know? What are they worried about?
Mm-hmm. And I mean, so much of the regular back to school routine has changed. Is it possible that some of these, I guess, maybe warning signs, I don't know if that's the correct way to label this, but is it possible that some of these factors, things that people need to recognize could pop up a little bit later on, like in the next couple of weeks or months?
For sure. I mean, this is all new to everybody. Kids are not used to washing their hands so many times at school. They're not used to wearing masks. And I think a lot of adults in particular are very fearful and anxious about what this means for their children. Mm-hmm. In my experience in the office, I've seen hundreds of kids over the last few weeks that have come in with masks, and they, by and large, are not very stressed about it. What I find to be the case is parents are more stressed about it. Mm-hmm. They're worried what it looks like for them, for their kids, because we were not used to that when we were in school. For kids, it's going to be the new norm, and I find that they're actually much more flexible than we are as adults. So if you're kind of calm about it as a caregiver, you're not stressed, you're going to take your shoulders down and you put on a brave face, that will do a lot in terms of easing anxiety for your kids as well.
Mm-hmm. And for those parents who are watching right now and who are a little bit anxious, do you have any tips when it comes to opening up that conversation with their kids and maybe if they have concerns about something that they saw in the classroom or something that they're hearing about?
For sure. So I think we often have our own fears as parents and caregivers. So instead of asking specifics, I like to open up communication in an open way. Like, how are you feeling about school? Not, is school stressful? How do you find it different? What are you enjoying about it? What are some challenges you're facing? As opposed to being like, is it hard to wash your hands so many times a day? Mm-hmm. Right? So leaving it open to see what kids are feeling, because in my experience, a lot of kids are not as stressed as the caregivers, and we can really learn a lot about what their experience is.
Absolutely. Well, it is a stressful time and a busy time. So Dr. Dina Kulik, thank you for taking a few minutes to speak with us this afternoon. We appreciate it.